the one test that Rita had. It's called the oral glucose tolerance test. And it's about 3 hours long or sometimes longer, depending on which lab you're working with. This is why doctors don't want to do it, because it takes forever. And from what Jovi said, she said it was painful too, because they'll draw your blood. Depending on the lab, you'll probably do it like every half hour. Do you remember how many times they drew blood from you?
They
Rita?
They took it when I first got there, and then they took it every half hour for 3 more hours, for 3 hours.
Okay, so this is doing why this is a much better test for people as you're reversing your diabetes. It's going to show you the reason why they do every half hour is because as your food digests, it goes gets converted into sugar and it goes into the bloodstream. So if you're eating the glucose tolerance test, is you have a liquid drink and all it is glucose, which meaning sugar. It's 75 grams of sugar. Some places have 100 grams, but most of it's 75. So that tells you how quickly your body's producing insulin and how much insulin it's producing. So this test tells you 4 to 6 years in advance before you become diabetes if you have a problem with this test. And this is the test that should be done an annual physical. So I would recommend everybody at your annual physical ask for oral glucose tolerance test. And it'll tell you how your insulin is working.